Hello, I'm Dr. Barry Clarke. I'm the medical director at Northwood. I'd like to extend our condolences to those families that have lost loved ones. We have been a part of their life journey and we mourn their loss. This pandemic is unlike anything I've ever experienced in my 33 years of practice. We had to quickly adapt our medical approach based on this ever-evolving virus. In the early days, we were receiving updated directives for care on a daily basis. And I wanted to share a little information about how we innovated and adapted our medical care approach for our residents during this pandemic. First, we established a COVID unit on site, and we were preparing for possible infections, but had not anticipated the sheer volume of cases that spread throughout our Halifax facility. As cases continued to climb and staff that became ill had to self-isolate, our staffing resources quickly became depleted. Within 48 hours or so, we went from having a plan for managing COVID to needing to activate our emergency plan and bring in additional resources. I recognized the need to establish a COVID medical team that could act decisively and comprehensively to battle this virus. And so I was so pleased with the response we received to our call for assistance. Our medical teams were made up of many skilled healthcare practitioners who work collaboratively to manage the complex care needs of our residents. It included, in our first wave, paramedics who arrived at the break of dawn and received the list of residents who were positive that day and the days before. Their job was to do that first early morning assessment to see who was in most need for the second wave of care providers. The second wave included myself and nurse practitioners that would provide that acute care intervention and that care planning going forward for each resident. A third wave was a group of hospice nurses that identified when a resident required palliative care and we needed to communicate well with the families. A fourth group was a group of young new graduate of medical doctors and medical students that were helpful in doing further assessments through the day and collecting the data for us in the medical team room. And finally, the family doctors of the residents provided virtual care so that their routine needs would be met through every day. And they also provided the on-call support for them as well. And I continue to make myself available at all hours. We are also involved in some of the very important research, understanding why this virus affects our vulnerable population in so many different ways. I look forward to analyzing the data further and sharing these learnings with my colleagues throughout the healthcare sector. It is important that we continue to learn and ensure we are providing the best care possible. At Northwood, we believe in treating our residents with dignity and respect, and we consider their overall health and well-being in our decisions. In closing, as we turn the corner and welcome our staff and physicians back to Northwood, we continue to manage this outbreak. I want to thank our dedicated team of medical professionals, doctors, nurse practitioners, LPNs, CCAs, hospice specialists, and everyone at Northwood focusing on providing our residents with the best quality of life possible. Northwood is home for so many of our elderly community, and there is nothing more important to us than their health and well-being. On behalf of the Northwood team, thank you for your continued support. Please take care, be well, thank you.